Let me start with a number that will make your blood boil. $397. That's the average monthly cost of a brand name prescription in the United States in 2026 for one medication for 1 month. And here's the number that should give you hope. $5. That's what some of the exact same medications cost when you know where to look and how to ask. The difference between paying $500 and paying $5 is not luck. It's not having better insurance. It's knowing the secrets that the pharmaceutical industry has spent billions of dollars making sure you never learn. Today, I'm going to share those secrets with you. By the end of this video, you will know how to cut your prescription costs by 90% or more, sometimes to zero. You will learn about the online pharmacy that sells generic drugs at cost plus 15%, the free discount cards that beat your insurance copay every time, and the little-known patient assistance programs that give away expensive brand-name drugs for free. I will give you a step-by-step plan to save money, whether you live in the US, the UK, or Canada. And I will teach you the one question you must ask your pharmacist that can instantly drop your price by 80%. Let me save you thousands of dollars a year, starting with your very next refill. Let me start with the most revolutionary change in American drug pricing in a generation. It's called Mark Cuban Cost Plus Drugs. Mark Cuban, the billionaire from Shark Tank, launched this online pharmacy with a radical promise: transparency. He posts the actual cost of every drug, adds a flat 15% markup, plus a $5 pharmacy fee and shipping. No middlemen, no pharmacy benefit managers, no insurance company markups. The results are stunning. A 30-day supply of the cholesterol drug atorvastatin, the generic for Lipitor, costs around $6. The common blood pressure medication lisinopril costs about $5. The diabetes drug metformin is under $5. On May 19, 2026, President Trump announced a partnership with Mark Cuban to add nearly 600 generic drugs to the federal Trump Rx website, which functions as a cash price aggregator, helping you compare prices across Cost Plus Drugs, Amazon Pharmacy, and GoodRx. Over 559 of those generics will be provided directly by Cost Plus Drugs. Even brand-name drugs are seeing massive price drops. The blood thinner Plavix dropped from $756 to just $16 through Trump Rx. The cholesterol medication Repatha dropped from $573 to $239. The hepatitis C treatment Epclusa, which previously cost nearly $25,000, is now available for $2,425. And several major drug manufacturers, including Sanofi, have committed to listing their insulin products at $35 per month. Mark Cuban Cost Plus Drugs is not available for every medication. They focus on generic drugs that are widely used. They do not carry controlled substances. They are an online mail-order pharmacy, so you cannot walk into a local store. But for common maintenance medications for blood pressure, cholesterol, diabetes, and thyroid conditions, it is almost always the cheapest option in America. Now here is the pattern interrupt that most people don't know. Even if Cost Plus Drugs doesn't carry your medication, there are free tools that let you compare cash prices at every pharmacy in your neighborhood. The most popular is GoodRx. GoodRx is not insurance. It is a free discount card that negotiates lower cash prices with pharmacies. You go to their website or app, search for your medication, and it shows you the price at CVS, Walgreens, Walmart, Costco, and your local grocery store. Often, the price with GoodRx is lower than your insurance copay. For the blood pressure medication lisinopril, a GoodRx coupon can bring the price down to around $5 per month. For spironolactone, a GoodRx Gold membership can bring it down to $2 to $5. Single Care is another free discount card that sometimes beats Good RX. At Single Care, a 30-day supply of generic spironolactone can be as low as $1.49 to $3.80. Optum Perks is a no-registration, no-fee discount card that can save up to 80%. The key is to check all three before you fill your prescription. Prices can vary by $20 or more for the exact same medication at the exact same pharmacy. But here is the most important warning about discount cards. When you use a discount card, you are not using your insurance. That means the amount you pay does not count toward your deductible or your out-of-pocket maximum. If you are on a high-deductible health plan and you are close to meeting your deductible, paying a few extra dollars using your insurance might be better in the long run. Use a discount card when the cash price is lower than your copay and when you are not close to your deductible. Otherwise, use your insurance. Now let me talk about a secret weapon that most people don't know exists: manufacturer patient assistance programs. If you take an expensive brand name medication that does not have a generic equivalent, the drug company that makes it may give it to you for free. These programs are designed for patients who are uninsured or underinsured and cannot afford their medications. The Bayer U.S. Patient Assistance Foundation, for example, helps patients get their Bayer prescription medicines for free if they face financial challenges. There is no fee to apply. Amneal Pharmaceuticals offers a patient assistance program that provides free medications for up to 1 year for eligible patients who are uninsured, underinsured, or facing financial hardship. Regeneron announced an agreement with the U.S. government in April 2026 to provide an innovative new gene therapy for free in the United States. Major pharmaceutical companies like Bristol-Myers Squibb, Pfizer, Merck, and Gilead have their own patient assistance programs. You usually need to fill out an application, provide proof of income, and have your doctor sign off. But the payoff can be huge. Medications that cost thousands of dollars per month can be free. Now, let me give you the single most powerful strategy for lowering your drug costs immediately. Ask your pharmacist to check for a better price. Seriously, many pharmacists have access to discount codes, manufacturer coupons, and cash price options that they will not offer unless you ask. A Reddit user recently shared a story about going to Costco to pick up a prescription for his parents. The pharmacist noticed he was paying full price and took the time to look up a manufacturer coupon. The final price was 90% lower than the original cost. Costco also has a member prescription program called CMPP that gives members access to negotiated discounts of 20 to 80%. And here's the kicker: you do not need a Costco membership to use the Costco pharmacy. Most states require pharmacies to serve the public. Just tell the door greeter you are going to the pharmacy. You can also use the Costco pharmacy without a membership for prescriptions, vaccinations, and hearing tests. The same is true for Sam's Club. Walmart Pharmacy also offers a $4 generic program. For example, a 30-day supply of generic spironolactone costs about $6.89 at Walmart with no coupon needed. For 90-day supplies, the per-pill price drops even further. What about other money-saving strategies? Ask your doctor for a 90-day supply instead of a 30-day supply. The per-pill price is almost always lower. Ask your doctor if there is a generic alternative to your brand name medication. Generics contain the exact same active ingredients and must meet the same FDA standards, but they cost 80 to 85% less on average. Ask your pharmacist if you can split higher dose pills. Some medications can be safely split, effectively cutting your cost in half. Ask your doctor for free samples. Many doctors receive samples from drug representatives and are happy to give them to patients who need help. Check if you qualify for state pharmaceutical assistance programs. Every state has programs for low-income seniors and people with disabilities. Contact your state's Department of Health and Human Services. Now let me talk about the UK, because the entire system is different. In England, the standard NHS prescription charge is £9.90 per item. That is the price you pay per medication, per prescription, regardless of what the drug actually costs. The NHS low-income scheme can reduce or eliminate these charges for people on low incomes. If you receive universal credit or other qualifying benefits, you may be exempt entirely. Approximately 89% of prescription items in England are already dispensed free to children, people over 60, pregnant women, and people with certain medical conditions. For working adults,